The 10 processes, called the Caritas processes, were developed by Gene Watson to make the nursing process less task-oriented and machine-like and bring it back to the core of caring, compassionate healing. Embrace is the process that most appeals to me. Embrace is the practice of putting yourself first. In order for us nurses to put ourselves first, we must first be whole. The number one reason the majority of us have become nurses is to help someone. The best way to give yourself is to have a whole, healthy self to give. You, the nurse, the caregiver, the most trusted profession, must be firing on all cylinders, mentally, physically, emotionally, and spiritually sound. You must be able to practice what you preach. The process of embrace suits me now in my practice, as early on in my career, I was blinded by my desire to help others and let my own physical and emotional health become fragile. Thankfully, I eventually recognized the dangerous place I was in, and I have since evolved, practicing and promoting positivity through early recognition to care for myself. You need to take time to indulge in enjoyable activities to recharge and regroup, implementing self-care. Finding the time for self-care can feel like an impossible luxury in the fast-paced world of nursing. Neglecting your needs can lead to burnout, decreased job satisfaction, and compromised patient care. Once you have embraced yourself, your compassion, strength, kindness, and understanding, you are able to share and grow in your profession with a broad foundation. The process is reflected in my practice by my overall attitude about working, waking up and going to work, being excited to start my day. Embrace is also reflected in my behavior towards patients. I smile, introduce myself, set expectations, take the time to really listen to their needs and wants, educate. I am present. On my unit, I can encourage my teammates, celebrate little victories, teach them, communicate supportively, as we all have been in their shoes. All of these are examples of caring for and elevating your inner self and outwardly applying, embracing the foundational process. One clinical example of the embrace process showing meaningful positive connection with the patient and being present for them is escorting your patient to imaging, making sure they are warm enough by providing them a warm blanket, talking to them through the procedure, giving them the approximate wait times, and advise them on what the next step will be. Make them feel like they are not alone, that they are just a task. A clinical example of embrace process and inner self-care. Make sure you prepare for your interaction. Do your research before introduction. Take an intentional time out to breathe and release. Slowly plan your entry. Do not appear rushed or robotic or task-driven. Know your limits. Make sure you're resting, meditating, exercising, reading, or whatever you can do to help yourself to release and let go. A clinical example of the embrace process towards the unit and colleagues. Be welcoming to your new staff. Teach them the tricks of the trade. Teach them your trade secrets. Bring them along for a new task. Provide them patience to learn. Provide them supportive communication and celebrate the victories. My department and the Caritas process of embrace are alike because I believe the ED is a broad foundation. We are at the base of the hospital and the beginning of the patient's journey. We set the tone for the whole visit. The emergency department often works in close coordination with other hospital units such as surgery, intensive care, and radiology to provide seamless patient care and facilitate timely transfers. Much like Embrace is the foundation of the Caritas process, it is a beginning, a guide through the caring science. In order for other units to be successful caring for and nurturing the patients, it started with the ED working on all cylinders as the foundation.